Do you know that chemotherapy can be safely given to treat cervical cancer during pregnancy if required after the completion of first trimester? Hello everyone, I'm Dr. Alka, Gynaecology Oncology Consultant in Max Hospital Shalimar Bagh, and today we are here to discuss the various treatment options that we have to manage cervical cancer during pregnancy. So there are two very important aspects which have to be taken into consideration during managing cervical cancer during pregnancy. These two are, first, what is the size of the lesion and which stage it belongs to, and secondly, what is the gestation of pregnancy. For example, if the patient is having a microscopic lesion which was detected either before pregnancy or during pregnancy, these lesions can be easily managed either by a simple cervical removal surgery which is called as trachelectomy, or the other way of seeing it is if the patient is less than 22 weeks of gestation, we can do a lymph node dissection which will help us stage the patient. If the lymph nodes come out to be positive, then in that case it immediately becomes stage 3 and the patient is encouraged to terminate the pregnancy. If not, then we can again do a simple trachelectomy. The other thing is, if the patient's lesion size is bigger, that is more than 2 centimeters in size, and the patient is less than 22 weeks of gestation, then we have two options for the patient. Either you terminate the pregnancy or you give neoadjuvant chemotherapy to the patient, but only after she completes her first trimester, because it can have detrimental effects on the fetus if given in the first trimester. But if the patient has already crossed 22 weeks of gestation and the lesion size is large, we have two options. Either we give the neoadjuvant chemotherapy and do the rest of the treatment after the delivery, or we ask the patient, after explaining the risk, to delay the treatment till after the pregnancy or the delivery is done. It all depends upon the stage, the patient's consenting, and what the patient expects, whether the patient understands the risks with delaying the treatment or taking the treatment. So a thorough counseling of the patient and the family members is very important while treating cervical cancer in pregnancy. So diagnosing it on the right time, offering the right treatment, giving the patient and the family members the counseling that is required is very important and is required to manage this situation successfully so as to have good maternal as well as fetal outcomes. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.